All right, welcome. Today we are diving deep into the body's most critical command center, the cardiovascular system. We're going to explore the incredibly powerful drugs that help manage this amazing network of pressure, plumbing, and pumping. Let's get right into it. So, just to frame this, think about the sheer scale of the problem we're trying to solve. We're not talking about a few feet of pipe here. Your body has a mind-boggling 60,000 miles of blood vessels, and it's a closed system, all powered by one single pump. Every second of every day, your heart and kidneys are making these tiny, perfect adjustments to keep it all running smoothly. But when that system gets out of whack, we need to step in. And that right there is where pharmacology becomes so important. Okay, so our first big problem is one I'm sure you've heard of, high blood pressure or hypertension. It gets called the silent danger, and you're about to see exactly why that's no exaggeration. So what is hypertension really? Well, it's pretty simple. The force of blood pushing against your artery walls is just consistently too high. Imagine your home's plumbing running with way too much pressure all the time. Eventually, that constant strain is going to damage the pipes and totally overwork the main pump. So the goal of treatment isn't just about lowering a number on a chart. It's about preventing a total system catastrophe down the road. That's why getting that pressure below 140/90 is so critical. So how do you actually fix that? Well, this is where it gets kind of simple, actually. If you want to lower the pressure in any closed plumbing system, you've really only got three main levers to pull. You can take some of the fluid out, you can slow down the pump, or you can make the pipes wider. And as you're about to see, the main drugs we use are engineered to do exactly one of those three things. Let's start with strategy number one, just reduce the amount of fluid. That's what diuretics do. They essentially tell your kidneys, hey, let's flush out more salt and water, which then lowers the total volume of blood in your pipes. Now, diazides are kind of the go-to for many people just starting out. They're gentle but effective. But when you've got a really serious fluid overload situation, that's when doctors bring out the heavy hitters, the loop diuretics, like furosemide. They have a much stronger effect. Now for strategy three, relaxing the pipes. And this is where a class of drugs called ACE inhibitors comes in, and they are just incredibly clever. See, your body has this natural chemical called angiotensin II, and its whole job is to tell your blood vessels to squeeze tighter. It's a constrict signal. Well, ACE inhibitors work by blocking the enzyme that makes that chemical. So you block the signal, the blood vessels don't get the message to squeeze, they relax, and voila, the pressure drops. But what about that weird, nagging dry cough some people get? Well, it turns out the same enzyme that ACE inhibitors block is also responsible for breaking down another chemical in the lungs. When that second chemical builds up, it causes irritation. It's a perfect example of how a very targeted drug can have some unexpected side effects. All right, so we've handled the pressure in the pipes. But what happens if the pump itself, the heart, starts to get tired and weak? This brings us to our second huge topic, heart failure. Now, this is super important. Heart failure doesn't mean your heart has stopped. Not at all. It just means it's failing to keep up with what your body needs. The pump has gotten weaker and the blood flow just isn't efficient anymore. This causes a kind of traffic jam, a backup of fluid, often in the lungs. And that's what leads to those classic symptoms like getting tired really easily and feeling short of breath. So, treating heart failure isn't a one-shot deal. It takes a multi-pronged attack. First, you've got to get rid of that extra fluid that's causing all the congestion, so you bring in diuretics. Second, you want to make the pump's job easier, right? So you use ACE inhibitors to relax the blood vessels and reduce the resistance. Third, sometimes you need to actually make each pump stronger, and that's where a drug like digoxin comes in. And finally, and this one might sound a little backward at first, you use beta blockers to actually slow the heart down. This reduces its overall workload, giving that strained muscle a chance to rest and recover over the long haul. I really want to pause on this point about digoxin for a second. The phrase narrow therapeutic range is a perfect illustration of just how tricky pharmacology can be. What it means is that the dose that really helps the heart is very close to the dose that can become toxic and cause all sorts of dangerous problems. It's like walking a tightrope, a powerful tool, but one that you have to watch like a hawk. Okay, on to our third problem. This one isn't about the overall pressure or a feeling pump. It's about a very specific kind of pain called angina. And it happens when the heart muscle itself is literally starving for oxygen. It all boils down to one of the most basic concepts in economics, supply and demand. That's it. When you exert yourself, your heart works harder, and its demand for oxygen-rich blood skyrockets. But if the arteries that supply the heart are narrowed, they just can't keep up. The supply can't meet the demand. That painful mismatch is what causes the chest pain of angina. So, how do you fix that mismatch? Well, if you're having an attack right now, the go-to answer is nitroglycerin. It's a potent drug that rapidly relaxes blood vessels all over your body. This does two amazing things at once. It reduces the amount of blood coming back to the heart, and it lowers the pressure the heart has to pump against. The result? The heart's workload plummets, its oxygen demand drops instantly, and the pain goes away. Now, for prevention, doctors will often use beta blockers to keep the heart from working too hard and a low-dose aspirin to keep dangerous clots from forming. But the story doesn't end with just pressure and pain. The incredible ability of these drugs to influence the heart and blood vessels makes them absolutely essential for handling a whole range of other critical situations, as we're about to see. Just take a quick look at this. You can think of this as a snapshot of the emergency toolkit. For instance, if the heart's electrical system goes haywire, that's an arrhythmia, you use drugs like amiodarone to try and get it back into a normal rhythm. Or think about a life or death scenario like shock, where blood pressure has crashed. In that case, you use powerful drugs called vasopressors, like noradrenaline, to literally squeeze the blood vessels and force that pressure back up to a level that can keep someone alive. It's an amazing set of tools for the toughest emergencies. So if there's one thing to take away from all of this, let it be this. All of these different drugs, from diuretics to AC inhibitors to nitrates, they're all just tools. They're incredibly sophisticated instruments that are all designed to do one thing: help doctors manage and fine-tune the body's delicate balance of pressure, fluid, and flow. All right, you've made it this far. Time for a quick knowledge check. We've gone over a lot of ground, so let's see if you can apply what you've learned to a really important real-world scenario. Imagine this. Someone starts feeling that sudden, crushing chest pain of an acute angina attack. They have their medication right there with them. Based on everything we've just discussed, what is the absolute first pharmacological step they should take to fix that dangerous supply and demand mismatch? Think back to the immediate solution we talked about. Thanks for watching The Explainer.